I'm going to show you a postural tip that really helps with inner knee pain. It really helps to stabilize the knee joint, the hip joint, the pelvis, and the lower back for lots of functional movements like a squat in particular. And so the first thing you need to know is that the body uses spirals for stability, and it really likes external rotation spirals. When we open up our posture like this, it's the opposite of the closed down posture that we see in poor posture or people who are, aging. The aging population is an internal rotation posture, and we're curling down, back down to close up. And so we want to stay open. And so we're going to utilize this spiral, this external rotation spiral with our hips to create stability in our body. So with Scully here, you can see that he is a little bit pigeon-toed. And that pigeon toe doesn't actually happen from the ankle or the foot most of the time. It actually is a rotation of the hip. And you can see as I externally rotate the hip, the pigeon toe gets corrected. And so it's this external rotation that the body really likes. And so what we're going to do to apply this to movement is you're going to plant your feet on the ground and you're going to apply that external rotation, and your feet aren't actually going to move. If you can see my feet, this is without that external rotation force. My knees kind of collapse inward. It's not very strong and stable. As soon as I apply that external rotation, my feet are wanting to go like this, but they're fixed to the ground so they don't move. And that force just goes up through the joints, stabilizes the knee, stabilizes the hips, locks in the pelvis, and it's really good for lower back stability as well. So all I'm doing is applying the force. Feet are actually fixed and I can feel it go up through my body. This external rotation is this spiral of stability, and I can use it when I do squats, and it prevents my knees from collapsing inward, and it just feels really good throughout all the joints. So go ahead and try it, see what it feels like for you, and hopefully it helps. So now we'll go to the live Q&A portion of the stream, and I'll see you guys there. Hello and welcome to Core Balance Coaching. I hope you enjoyed that video on the deep spiral of the body. And hopefully everything's working all right. Still getting used to a little bit of a new, some new technology. So I see some people are here live. Welcome, and thank you for being here. My name's Dr. Ryan Peebles, and I'm a physical therapist by profession. I've dedicated the last 20 years of my life to better understanding and reversing the root causes of chronic lower back pain. If you enjoy the video, feel free to hit the like button, help support the stream, and help spread the word to people out there on YouTube that there is a solution to chronic lower back pain. So let's dive in a little bit deeper to what I was talking about with the spiral of the body. And I have some images. I was looking for some images online just before the stream. Nothing really came up that I loved to help, just be an illustration of what's going on, what I'm talking about. So I might create my own graphic, which I've done many times in the past. But here's what I've found. Let's get this out of the way. So this is kind of what happens in the body with the internal rotation, which is the opposite of, what we're trying to do with this spiral. And you can see that this affects the foot. This can cause flat feet. It affects the ankle for sure, the knee, the hip. You can see it even affects the level of the pelvis. It can be a correlation, maybe even a causation, who knows, of scoliosis. You can see the curvature of the spine is affected by all of this. So it's a really big deal. And I've been wanting to do a video on this for a long time. So here we are, finally got there. I have so many topics I want to do. Here's another image just found by searching Google, and we can see how the whole body is connected. And so these are showing the problem, right? And this one was the only one I could find that actually shows external rotation at the hip and how it kind of
lines everything up. It really helps just to make you feel more stable when you're, say, going down to lift something up. And it can be a very gentle intention of that external rotation. It doesn't have to be a high intensity thing. It's just enough to get your body in alignment. And so we want to kind of look like this side of the image, not so much this side of the image. So hopefully those kind of help for you. And I'm sure maybe there are some questions, so I'll take a quick look in the chat. I see somebody that probably lives in Kauai. Hello. You're in Module 4. All right, great to hear. It says you're doing the program faithfully. If your SI is out of whack and pelvis is turned, do I just have faith that working on the program is strengthening the muscles and training the body? Okay, yeah, so this is kind of related to the topic a little bit. If you could imagine, I'll show the image again. If you could imagine, let's see if I can find one that really, I guess this is the best one. This internal rotation here, Kauai, if you can imagine, that is pulling on the pelvis in a certain way, causing it to open in the back. And so everything's kind of coming in that same spiral rotation. And so if you have SI joint problems, it's actually highly effective. And I mentioned this in the video. It locks in the pelvis as well to have that external rotation, and we'll have that same external rotation. Imagine that same arrow on the pelvis, and it helps stabilize that SI joint deep in there. Let's see if I can find an even better image of the SI joint. So this SI joint here, you can imagine an arrow going this direction, causing a force to close it down, which is what you want. With SI joint, it's often instability that we're dealing with. So you want that stability with that keystone shaped joint, you want closure there. So I know that's not exactly the question you asked. I just want to show how this posture is related to so many of the things, the problems that we deal with, the inner knee pain, patella tracking disorder, chondromalacia. There's so many diagnoses that we label that are all results, right? They're all damage, they're all degeneration related, but there's an underlying monster that could be correlated, contributing to lots of different things here. So yeah, I'll answer some questions in the chat, and then as usual, we will get into the live Q&A of that was prepared by Asti, our faithful admin for Core Balance Training from students in the Student Hub. So Kauai, just to answer your question a little bit more, yes, faith is a good thing, but it's not the only thing. The program is going to help bring balance to your overall body and posture, and it's a general outline that can apply to human beings. That said, everyone has their own unique little things, so you'll want to put more effort and more energy into certain things in the program that you feel are more beneficial to you. So that's one of the rules that we have. One of the concepts that we practice is do more of what's working and less of what's hurting. So that applies to things in the program. I don't believe really there's things in the program that are going to be doing much harm, but you can apply it just to do more of what's been helping you, and you, in that sense, tailor the things in the program to help stabilize or balance or level your pelvis. Say you're doing a single leg activity. There's a lot of them later in the program. You're only in Module 4, but so at this point, Module 4, some of the alternating movements would be the front anchors challenge. Say you can spend more time, more effort working on the side that's more challenging, more difficult, when you're, bird dog, basically raising one leg and one arm. Find out discover the imbalances in your body through experimentation, and then spend more time on the side that's weaker, doesn't have as much endurance, you're just a little more challenging. So that's my advice. And definitely you're in Module 4. That's the module where the SI joint stabilizer comes in. So that's going to be this is a long game. Anytime you're doing SI joint, it's a long game. So it's going to take time for the results to feel the results. But I'd be making the SI joint stabilizer bridge my best friend for the next couple months is my advice to you. So yeah. So and the next question you had was kind of similar, right? Well, your SI becomes stable. Yeah, that's the goal, right? And it's going to take a lot of work. It's going to take patience. It's going to take persistence. But that tends to be what happens for a lot of people. It's what happened for me. I have a history of SI joint pain, and my SI joint, I can proudly say, happily, that it's stable now, right? And it's from the work. It didn't happen spontaneously. Is it okay to still go to the chiropractor? Yeah, that's okay. I've talked a lot about strategies for chiropractic. It can be very beneficial. People think I hate chiropractors, but one of my greatest mentors was a chiropractor, and it can be extremely beneficial. It's just you don't want to get to the point where it becomes a dependency. And if it is, then you want to gradually wean off by doing the stability stuff right after you get your adjustment. So you stabilize, they move you back into place, and you want to stabilize it there and keep it that way so it doesn't come out of alignment or get loose again the next day. So you got to go back again, right? So that's the goal. And you're very welcome, Kwai. So let's keep going down the chat a little bit. SI joint. Okay, more SI joint. So hopefully you were listening, Rudra, because that's what I was talking about. And there's definitely things you can do for the SI joint. I got other videos, at least 2 other videos on the channel here specifically about SI joint strategies. Jonathan Schneider, Kenny Loggins in Montecito. All right. I don't actually spend too much time hanging out in Montecito, but I used to live there, and yeah, you get to see some interesting people. That's for sure. I was just renting a room in a house, but it's an interesting experience. I had a friend recently say that you kind of feel like you're in the caste system when you live in some of these areas around here. So I will look out for Kenny Loggins. I love that. And great to hear. 75 years old, no matter how old you are, you can still get stronger. You can still improve your body. You could be 100 years old and you can still get benefits from exercise. So Nepal. All right, Rudra. Let's see, Madeline. I'm going to try and catch up in the chat, and then I will go to the live Q&A with the student from the Student Hub. So Madeline, hips incredibly weak. When I start walking, my calves start burning. Is that normal? I would say, it's not normal in the sense that that's what the body should be doing or feeling, but it's normal in the sense that it's very common. So there are things you can do. And I hope that, the calves burning is communication from your body that they have extremely low endurance, or that you are overusing them to walk and you need to strengthen some of the other muscles around it, like the hamstrings and the glutes, those extensors, to help support the calves so that they don't have to do so much work. They might be doing all the work for your walking. So I usually like to go from the center, from the core out, and focus my priorities in that way. So the glutes are going to be a huge part for you, Madeline, to probably take the load off your calves. Sherry, all right. Core member showing up. Probably one of the most consistent live stream members showing up. Glad to see you here, Sherry. And the spiral's been really a big thing for me, and I can't believe it took me this long to share it, but there's just so much to share and talk about, and I'm glad to finally get this one out there. And I hope you all, whoever saw the beginning of this live stream, if you're tuning in late, go back and watch it. It's a really powerful tip or trick or whatever you want to do. It's a slight change you make to your intention and your movement that has an effect on the whole body. Tyler, yes, this program is highly targeted towards lumbar stenosis. Tyler Merkel, that's your question. Definitely, that's the problem that I had over many, many years. And so the program was designed to get myself out of back pain and lordosis, hyperlordosis, stenosis, all the things related to backward bending for sure. L5S1 is the main, this is really effective stuff for that. And L5S1 is the main level that gets affected by this stuff. So yeah, you can get your, regardless of the disc bulge and the fissure, you can get back to normalcy in most cases by just getting to the root of this postural problem. And then a question about the spiral from Sherry. Should we be doing this while hip hinging? Yeah, you can absolutely do this while hip hinging. It's easiest to do with 2-leg or bilateral movements like a squat or a hip hinge or a deadlift, or even just kind of standing, a subtle intention of external rotation, like 1% effort, right? It's possible to do on single leg stuff, unilateral stuff. It's just harder because you don't have that counterbalance force from your other leg. So yeah, you can do it in pretty much almost anything. Just don't overdo it, low intensity. And then this is the last question I'm going to answer right now before I switch gears. So from Helena, I've had very tight hip with pain. Can that come from lower back? Have a history of lower back pain? And if yes, how do I figure that out if it's from the lower back? So Helena, this is going to be kind of like a chicken or the egg thing. So the tight hip can come from the lower back, or the lower back pain can come from tight hips. So they're definitely correlated. They go together. Tight hips and lower back pain are like best friends. So one of the things that you want to do is you want to get better hip strength and mobility, and you want to create stability in your lower back through core stability. And in this program we focus on the deep core because those are the muscles closest to the spine, and so they have the highest ability, the best opportunity to create stability for the spine. So the superficial muscles on the outside can actually do their job of creating movement. So stability on the inside, the deep core, and movement, mobility on the outside muscles. So, all right, so let's go ahead and switch gears. We've got some, we'll go to the slides here. Again, that's the image that we are addressing, the postural problem that we are addressing through this spiral that I showed in the beginning of the video. Before we get to the questions, we have a Student Hub Student of the Week. So congratulations, Marilyn Deeks. Says that you're committing daily, and so we're proud of you, and that's one of the reasons we chose you to be the Student Hub Student of the Week, and asking questions, really diving into this stuff and trying to understand. And that's the key. I believe that before you can heal back pain, before you can solve the problem, you have to understand the problem. And so I think it's huge when people spend effort, when students make an effort to try and really understand and grasp and wrap their head around what's happening to their body, so that then you can have a really focused effort towards solving the problem. So congratulations, Marilyn. You're the Student Hub Student of the Week. I hope you inspire other students to do the same. And we're going to add a month to your membership. You have to do nothing. We will just add an extra month to the back end, give you more time to focus on the areas of the program that you need most. All right. Everything working okay. Nothing skipping. Video working okay. I'd love just a confirmation in the chat from somebody. My audio's coming in good. Video's not skipping, because that's kind of happened in the past. Trying to address that. So let's go to the first question, and this is from Marilyn. So she says, I ordered an SI belt. Not sure how long before removing each step. Okay, yeah. So this is based on the video I created on the SI belt. So anybody with SI joint pain, you have an option to use an SI belt if the SI joint instability is bad or has been going on long enough. An SI belt is a good tool, but you want to be careful with how you use it. You want to use it with a strategy so that your body doesn't become dependent on it. So you want to wean off the belt. Your question, Marilyn, first question is, I assume you don't wear it while doing the program. So actually the first stage of wearing an SI belt, say the first week or two, you want to wear it pretty much all the time, except give yourself breaks for your skin to breathe or whatever when you're sitting or laying down. So yeah, you would wear it while doing the program. But then later, after those first 1 to 2 weeks, and you've created that stability, and you're coinciding that with doing stability exercises so that your muscles are also getting stronger, then you wean off the belt. And then maybe you would wear the belt during the exercises, because those are high stress, high strain activities on the SI joint, but maybe not wear it while lightly walking around your home. And so, yeah, I think wearing the belt during exercise is one of the longest stages, and it's one of the last things that you remove the belt for, is for exercise. But it goes with intensity. So the higher intensity the thing, the longer you'll continue to wear the belt for. And as you feel more stability in your SI joint, as you feel more confident, then you can gradually wear the belt less for the low intensity activities, and then gradually do higher and higher intensity activities without the belt. This happens over weeks and months, potentially, up to 2 months for this entire process, if it goes successfully without setbacks. Setbacks always happen. They often happen. So this might be a 3-month process. You give an update here. It says, I wore the SI belt for the first time this morning and it aggravated the center of the low back. I watched your SI videos. Might be a bulging disc area. I listened to my body and took it off. Good job, Marilyn. Did bridge. Feel better. Any advice? So the SI belt can be irritating. It doesn't often irritate the center of the lower back, but it can, you're squeezing something, you're changing something. My advice is to try again, but do it, put the belt on differently this time. Maybe you had it on too high. If it's affecting your lower back, you might have placed it too high. So it's a lot lower than you really think. It's going to be, I guess I can't get my mouse over there, but it's going to be a level with my mouse on that skeleton, very low, below your waist and between your pubic bone and your ASIS. So try lowering the belt, try and maybe don't squeeze it as tight, try a little more subtle application, and make sure your SI joint is in alignment before you put the belt on, because you don't want to lock in an SI joint that's out of place. That also can be the cause why, it's not uncommon for SI belts to actually increase the pain, because you're strapping it on and trying to preserve something that's out of alignment. So you want to make sure you've gotten back into alignment before putting the belt on. How do you feel about icing lower back and SI joint pain? Ice is great. Ice is fine. There's no real downside to ice. The best thing, I think, is alternating ice and heat. So I do cold plunges, I do cold showers, and I also like heat too. So hot tub or sauna, if you have access to these things. The alternating is really effective. And the icing, is, I think, more effective if you do full body rather than like specific areas. If you're just going to ice like your ankle or something, the main benefit you're going to get is to prevent further swelling and inflammation. It doesn't reverse swelling. Icing does not reverse or decrease swelling, as some people commonly believe. It actually just prevents the furthering of the inflammation or the swelling. So that's my belief anyway. People believe different things about that. So full body submersion, full body cold therapy has a lot more benefits that expand way beyond just inflammation. So hard to see where your back touches the floor when doing the bridge. Your shirt hangs shoulder blades. Should I be doing get fat throughout the day or just during the bridge? The contact with the floor, Marilyn, is depending on how high you come up in the bridge. So if you're in full bridge, it's going to be way up on your upper back, shoulder blades or above. But if you're not coming all the way up, you're like peeling your spine up off the floor almost. So it'll be lower down on your spine. And then get fat. This is a very subtle thing. Another very subtle thing, 1-2% strategy. And if you're not in the program, you're not going to have any clue what I'm talking about right now. But sorry about that. But get fat is a way to just make sure you are accessing, you're engaging the deep muscles of your spine to support your spine, deep core. And so it's kind of a thing that it's an awareness you want to have kind of consistently. A lot of this stuff is training for the movements of your daily life. And we use an exercise like the bridge as the training ground. So this is where you learn, because it's a wonderful exercise for learning body awareness. And then later you want to apply it, but it's not high intensity. It's not like a 10% effort. It's even lower. And it's more of just like, okay, like I'm doing the dishes right now. Maybe I should just check real quick. Am I using my deep core? So hopefully that helps answer your question. Marilyn, I want to brush my 70-pound golden retriever. What is the best way to get or sit on the floor? Maybe I should hold off. Best way to sit on the floor is going to depend on your body type. I would consider a super low, something I would do for my body, and I think would feel good for a lot of people, is just a super low bench or stool, like a little step stool. Just sit on that, and allows you to relax. It allows you to kind of have body awareness and not be straining. And it's a good position for the spine to be in. It's not really stressful on the spine to be sitting on a very low seat in most cases, unless you have a situation where you got a bulging disc pushing on a nerve with flexion. That's kind of an acute rare situation. But in general, posturally, a deep squat type position is actually not very nice for the spine. Okay, so I'm going to take a look in the chat because I know I asked a question and I got some answers. So everybody says everything is looking good. Thank you for that. That really helps me. And I'll answer some questions that came through as well. So Helena, answered that one. So Rudra, SI pain is arthritis. SI recover like before. Can you make this topic video? Yeah, so there isn't a video on the SI joint, Rudra, already on the channel. There's 2 of them, but I will continue to make more, and because it's a very hot topic and people like the education. So yeah, thank you for the request. SI joint pain is arthritis. Yeah, the definition of arthritis is joint inflammation. Most people think of arthritis as like a long-term disease that you get as you get older, but that's more actually arthrosis. That's long-term inflammation. Itis is short-term. And so, yeah, any kind of joint pain is arthritis. It's a very big umbrella term. So yes. Rusty, does this program incorporate neck exercises? My neck is really stiff and hurts. So that's a big, long answer. And the best thing I can tell you right now is no, the program does not do specific neck exercises, but often the case for the reason why necks become stiff and painful is because they are overcompensating for postural imbalances that exist throughout the body, especially pelvis, lower back, and upper back. The upper back, the thoracic posture really has a huge impact on the neck, but the upper back is impacted by the lower back, right? So it's a big continuous chain, and that's what we address in the program. So a lot of people do experience improvement in their neck pain from the program, but it's a byproduct of looking at the body as a whole. So yeah, hopefully that answers your question. Tyler Merkel, general thoughts about this program and arthritis within the lumbar region. So, the program primarily addresses chronic lower back pain, which is back pain that's been going on for, more than 3 months is the technical definition, but I would like to think that in many cases, in the vast majority of cases, it's back pain that's been going on for years, at least a year, multiple years, 5 years, 10 years, 20 years, 30 years. We've had students that have back pain for 35 years, and yes, get better and improve their lives and go on to be able to live a better life. So that's what we're addressing, is chronic. And with any kind of chronic condition, Tyler, yeah, there's going to be arthritis. There's going to be degenerative changes in the joints that are affected by the problem. But what we don't do is we don't address the pain. We don't address the arthritis. Those are the results of the problem. The problem is upstream, and that's what we want to address, is the root cause. What is happening upstream that is causing these problems to happen, that these downstream problems. And often what I've found, what I believe, is that it's related to muscle imbalances, a predictable pattern of muscle imbalances that happen throughout the body. And you can get all kinds of, you can get bulging disc, you can get stenosis, you can get all kinds of different things. It's just the effects vary widely. So we're trying to take a long-term approach and get rid of the cause of the problem, so that when we do, you want to do something like, I don't know, PRP or stem cells to heal up, the problem that caused the damage is no longer there. So it allows your body to heal, and you don't need those things to heal. It's just an example that you really, surgery, whatever, any kind of treatment you get, you want to make sure you're also addressing what caused you to need the surgery in the first place. The surgery is really just the last stage of the process. We're only addressing the result with surgery in the vast majority of cases. So yeah, hopefully that answers your question. Let's get back to the slides. We have a question from Caitlin. Are there any progressions for the back anchor challenge that are not yet mentioned in the program? Just for anybody who's here live and not in the program, these are questions that we prepare from students who are actively in the program in something called the Student Hub. That's where they ask the questions. And so these are where we answer them on a weekly live stream. So if some of this stuff doesn't make sense, it's because we use a language in the program to talk about posture, like the back anchor and the front anchor. So we've assigned words to different areas of the body so that we can then talk about them, because they didn't really have a way to talk about it and connect with it prior. So hopefully you can just kind of know that if it's not making sense to you, that's okay. Progressions for the back anchor challenge. Back anchor challenge is very similar, pretty much the same thing as dead bug or dying bug exercise, but we're taking a different perspective where we're connecting to our core, and that's the challenge, is the back anchor. Yes, Caitlin, there are definitely, there are infinite progressions. This is an exercise that you can get real creative with. So let's read what the rest of what you have to say. I can easily do the marching and the bridge. Okay. Yeah. So the marching is an excellent one for that I still do today. If I feel like I need a reset. So even though you can easily do them, you can still benefit just from reminding your body of this connection while doing reciprocal movements. That's why marching is very effective. It trains reciprocal movements, which we use to walk and for almost everything. But as soon as both legs leave the ground, my back arches and I lose the back anchor. So that's game over for you, Caitlin. You want to stop, reset, and go again. So you don't continue. You don't try to reconnect your back and continue. You stop, totally reset, reconnect, and start over. If I put my hands under my butt to lift up a little, I can feel the engagement of the muscles I think I'm supposed to be targeting in my core and deep core. Is that okay to do? It's okay to do modifications that will allow you to then progress to the thing that was, too hard for you to do or harder to do. So it's all about progression. And so we start low and slow and we progress and we build on that. But at any time, Caitlin and anybody else, if you need to create yourself a regression or something that makes it easier, a prop or a modification that allows your body to do this for now, then that's okay. And what you want to do is you want to progress from there along the same progression towards increasing the challenge. But the golden rule is you maintain the core connection, the back anchor. In this exercise, it's the back anchor connection. And so, yes, it's okay. What was the other part of your question? Any progression? So I would just say, Caitlin, the back anchor challenge is the most common, and this is important. So by far the most common thing that I would change about the back anchor challenge for students in the program is that they don't go as far or as intense so early. Start really slow, really light, and master just being able to lift up one leg and put it back down and like feel like you're super confident with it. And then the other leg. And then eventually get to the point where you can lift one leg up and then the other leg and hold both of them up and just breathe and maintain connection. So basically my advice is to turn down the intensity and the challenge to where you're at. Because it seems to me like you're trying to challenge yourself beyond the ability of your body to maintain the connection. You're challenging yourself too much. So you're trying to progress too fast, which is the most common thing that I think people do with this exercise because it's so attractive to want to do the full dead bug or dying bug. And it's done in physical therapy clinics and people are doing it with a major collapse in their spine and they don't even know it. So the connection is priority and the amount that you lift or move your legs is by far secondary. You can even just practice moving your arms, and leave your legs to be, and that's still very effective. So hopefully that helps for you. Next question is from Caroline. She says, I've had low back pain for 4 years. I recently had an MRI that showed very early sacroiliitis. And my rheumatologist said it looks like the beginning of ankylosing spondylitis. Wow, I really am not... I don't like that feels to me like a doom diagnosis. Like he's dooming your future. So that's just a rheumatologist is by definition going to be biased towards rheumatic disease. That's the confirmation bias. They're looking for a rheumatic disease, and that's what they call that ankylosing spondylitis is something that's progressive like that. But there are lots of causes of inflammation. So sacroiliitis, itis just means short-term inflammation. There are lots of different causes of inflammation in the sacroiliac joint. And I would treat it like a normal SI joint pain first before, allowing my mind to accept that I have a progressive disease that's going to have a big impact on my life in the future, and see what you can do. And there are ways to slow it down, I believe. This is just my belief. So you can take it for what it is, but I just don't really like the doom diagnosis like that. Are there any specific exercises from the program that would be best for me to do most often? Have you seen patients with AS recover? What is your theory about the cause of AS? I love this question. I love your questions, Caroline. Keep asking questions. Ask your rheumatologist questions. Get second opinions. Here's my second opinion. I believe you can slow down or even prevent AS from progressing through stuff like exercises that you're asking about. So SI joint stability exercises, since ankylosing spondylitis is by definition it's a stiffness disease. So the joints become stiff. I'm not sure what your SI joint is like, if it's stiff or unstable. I think it's in most cases, people with SI joint pain have a hypermobility, unstable. But if yours is stiff and painful, then you want to do mobility exercises. But definitely the butt buster bridge, the SI joint stabilizer bridge, is really effective for SI joint pain, and that's one of the ones I would have you focus on. If you're getting the clicking and the popping with like a bicycle type movement, or the back anchor challenge, if you extend your leg too far and then you bring it back and you're getting a click or a pop, you most likely have, instability in your SI joint, and that is not ankylosing spondylitis by definition. So my understanding may be wrong, but that is my understanding. So I'm going to continue reading. It says, I'm committed to whatever it takes to be healthy. I've worked very hard to lose 130 pounds. Wow, that's huge. Congratulations. Very proud of you for that. Whole food, plant-based, 10,000 steps a day. Sounds like you're doing lots of wonderful things. I want to have children soon. I'm afraid I won't be able to due to the pain. Any lifestyle tips that can help me heal would be greatly appreciated. Consistency, persistence, that's absolutely number one. So whatever you do, whatever you choose to do, the 10,000 steps a day, the plant-based diet, the choices you make to get healthy should be ones that you believe that you can continue to do for the rest of your life. I don't believe in short-term strategies like a diet. I don't really, in most cases, if you want to stay healthy, you can't go back to a previous lifestyle and not lose the benefits that you got from something like a diet. So the choices you make need to be something that you can just be persistent and enjoy, enjoyable things in your life. My general recommendation is, eat green food. If you choose to eat meat that eats green food, or, grass-fed, and lots of movement, and movement that you enjoy, so that you're taking care of your mental health as well. Most of my movement these days is outdoor activities because that's what's enjoyable. Some people enjoy being indoors and moving in the gym, but you got to do what you enjoy so that you can continue to do it. And movement is going to be the best treatment for AS. And I believe that it's very much a postural condition. My theory about the cause is that it's a long-term effect of postural and chemical abnormalities. Is like the meeting of two, is a perfect storm of the chemical and the lifestyle that can create this to be like a permanent postural position where your spine is almost fused, and it's more of that curled, hunched posture oftentimes. So stay open and keep moving. Hopefully that helps for you. We do have one more question, but I'll take a look in the chat because I like to prioritize people who are here live. So Aaron Carr says, when on the floor and doing the anchor and the bridge, I have a pain wrapping around the right side of my pelvis. It's bearable. I can get through the exercise, but annoying. Any ideas? Okay, so let me just read through this again. I think you're talking about the back anchor and the bridge. The fact that, Aaron, that you say that it's bearable makes me kind of feel like is not a bad pain. So I've done multiple streams where I talk about the difference between good pain and bad pain. It's also written about in my pain FAQ that you can access in the program. And so you want to kind of determine, is it good pain, or is it a pain, or is it a bad pain, that you want to avoid? Or is it a pain that is just kind of your body communicating to you that like something is changing, like that position is affecting something, and it may be okay. Intuitively, you could feel like it may be okay to kind of lean into it a little bit and see how you feel afterwards. So I'm going to go ahead and say that it seems okay to me, and it seems like it's wrapping, so it's more of a sling or a fascia or muscular type thing, not necessarily a joint that's inflamed or injured. So that's a good thing when it's more of soft tissue type pain. And those are the ones that you can kind of play with a little bit. So yeah, keep leaning into it, keep feeling into it. Don't go high intensity and like push through it, but kind of like edge into it and see where it goes, and then get up and see how your body feels, and then the next day use that knowledge that you gained from the day prior to guide your routine, and do that over and over again, and you'll continue to gain more knowledge about your body, and that's the goal, right? We want to learn our bodies, and we want to just improve. We want to optimize the way that we use them and move them. You've got some more information for me, but I see from Matt Long, I had the same problem as Caitlin at first, but now I can connect my back anchor directly to the floor. I wish I had read that when I was doing Caitlin's answer, but that's really great, and I hope she sees your comment, your chat message, Matt. Thank you for sharing that. Hope is a really important factor. Hope and belief are really important in this whole process. So it's great to hear from other students about, oh yeah, I had that too, and I was able to overcome that. That's massive for people to be able to hear that. Just kept plugging away. I love it, Matt. That's what you got to do. Aaron says, sometimes my pelvis just feels like it needs to be stretched. Do you have an active stretch that can address this area? That's an interesting one, because sometimes stretching is helpful, and sometimes it's a feeling like lower back tightness. Lower back tightness often feels like, man, I just want to stretch that out. But what we find is that it just tightens right back up within hours, right? And so when you're stretching and then experiencing the retightening over and over and over, it can lead to breaking down of the tissues, the integrity of the tissues. And so you want to make sure the stretch is, and the reason it retightens back up is that there is a reason. There's always some reason why the body's tightening. It's a protective thing, and I'm not going to claim that I know the reason why your pelvis has that tightness. It seems like it might be one-sided, which can often be a thing where, you have a left-right imbalance. And so do you want to stretch it, or is it tight for a reason, and stretching it is actually undoing the thing that your body's trying to accomplish, the protection or the stabilizing of that area? So that's another thing you got to figure out about your body, because it's to each their own. Each individual situation is a little bit different, and it's going to take that kind of reflection, and it's going to take kind of a lot of focus while you're doing the movement. And you can try stretching and see, follow the tightness with the stretch. I don't know exactly where the tightness is, Aaron, so I can't say like do this stretch, but crossing your leg over to one side of your body, so you're laying on your back and you cross one leg over, and let it kind of, that's often done in I don't know if it's a yoga move or Pilates, or just kind of a stretch that people do before activity, and your leg is usually straight when you cross it over like that. That might be a stretch, but you want to feel what it feels like after, and how fast does it retighten back up? Because if it doesn't stay, if the benefits of the stretch don't last, then it only may just feel good to you because you're getting a little blood flow in the tightness, and that feels good. Getting oxygen to the tissues feels good, but it's not actually the feel good of addressing whatever the root of the problem is. Why is it tight? Often it's a left-right imbalance if it's only happening on one side. So you're going to want to find out a difference in the way you stand or the way you sit, or a weakness on one side. And when you're doing different exercises, pay attention. Oh, it's easier for me to do the dying bug or the back anchor challenge on the right, and the left I can't go as far, or it's harder. So you want to spend more time on the side where it's more challenging to bring up that the strength, or even it out, and you find that more balance. And then you might find that tightness on the side starts reducing because it doesn't need to protect like it was. So these are the games. This is a constant dance, and these are the games you have to play. All right. So, Aaron, my muscles in my middle, just above lower back, get very stiff, especially after standing, like cooking. How do you feel about the massage gun to loosen them up? Okay. These are great questions. So, I was just talking about low back tightness. Oftentimes, it's a compensation for other muscles not doing their full job, like the deep core, the deep abdominal muscles, not stabilizing the spine. So, the lower back has to do a little more stability. And how do muscles do stability? They tighten up. That's the only language muscles speak is tension, or basically opposite of tension is release, right? But they can only do one thing, is they can tense up or untense up. And so the lower back muscles are tight to help support your spine, most likely, to protect. It also can be a result of anterior pelvic tilt. So you want to pay attention to that. The massage gun is a great tool for certain things. I don't love it for right in the lower back, because if you have disc problems, vibration is not usually a good thing for disc problems. So you don't really want to vibrate discs. So you're sticking it right in there. If there is a disc issue, it's just sometimes it's not beneficial. And massage guns are also a treatment, a short-term effect treatment. So you're not going to get to the root of the problem, but they can help you along your journey to be a catalyst for loosening up muscles or releasing tightness if you're doing the other things simultaneously, which it sounds like you're doing, Aaron. So those are my thoughts on that. Madeline is here. I think Madeline, or is this a different? Yeah, that's Marilyn. Okay. Okay. So Madeline, thank you. I appreciate that. Vinny, getting from Barbados, stay safe. Oh, all right. I love how we're having people from different countries starting to show up. Greetings from Barbados, Vinny says. Haven't been there yet. It's on the list, and that's awesome, Vinny. Thank you for showing up here from Barbados. Brenny, multiples of stairs, i.e. 30. How to best posture climbs? There is a video lesson, Brenny, in the program on stair climbing. We build up to this over the first 5 modules, and then module 6 is walking week. So we apply everything we've learned in the first 5 modules to walking, stair climbing, walking up hills, walking down hills. It's a connection. And so I don't know if you're in the program, Brenny, but if you are, it's coming your way. And if not, then you might want to consider, there's a free trial. You can just see what it feels like for your body. And then if that first week feels good for you, you can then know that you're going to be building up to doing stairs with, the posture that we teach. There's not much I can say right now. You can apply the lesson from today to stairs, keeping that spiral open, just throughout the going up and down of the stairs. And it can be very repetitive. Stairs can be very repetitive. So I often switch. I'll do 1 step, and then I'll do 2 steps. I'll skip a step, right? And because I've got long legs, I can do every 3rd step. And so that changes the variability. It gives you variety, which the body likes. Variety is the spice of life, and it's also the spice for the body as well. So those are my tips on stairs. I'm going to go ahead and finish the last question. I believe there's one more, and then I'll finish up the chat if I can catch up. So Emily, let me just make sure. Yeah, so this is the last question from Emily. I'm on the Mastering the Perfect Bridge module right now. I'm definitely in the camp of not being able to do a very high bridge due to hip flexor tightness and lack of mobility in my lumbar spine, particularly L5-S1. So first, Emily, I'm just going to say that that's fantastic. That's great news, because what that means is, 1, you have awareness of your body. You've educated yourself. You understand what's going on. And most importantly, number 3, you have room for improvement. So if you are still experiencing pain, then that means you have a lot of improvement you can make to your body to continue to decrease your pain. The hardest thing for a therapist or any kind of health care provider is if somebody has a pain or a problem, but they're in perfect shape. They can do everything. They pass every test. And you're like, well, now what do? I don't really know where to go from here. But if you can identify weaknesses, or if you can identify compromises or compensations in the body, then that means that's good news. You can work on those, improve those, and you have a genuine path to go down to decrease the pain. So just wanted to say that, Emily. And then I have lumbarization of my sacrum, L6, which may contribute. Okay. Wondering if I can do a lower bridge for strength building, but then also a higher supported bridge with a foam block underneath my sacrum for additional hip flexor stretching without putting my lumbar spine at risk. I think that's a really good idea, Emily, particularly to do those two things not simultaneously, but in conjunction with each other, because you wouldn't only want to do the bridge with the foam block because you're not getting the strength, but you are getting the stretching and the hip flexors. And you wouldn't only want to do the lower bridge for the strength building because you are getting the strength, but you're not getting the stretching and the hip flexors. So to do both, you kind of get the best of both worlds, and the block can really help you to maintain your pelvis in a healthy position so the compensation is not going into your lower back. With the lumbarization, the L6 situation, I'm going to go ahead and say that you just want to treat your body as if it's normal. And I don't think that there is any changes that you need to make to modify for this. Okay, so that's just my personal approach. I don't personally have the lumbarization, so a lot of this stuff I do speak from personal experience, because I've just with my long history of chronic back problems, I experienced a lot of the different things that I help people with. But this is one of those that I'm not speaking from experience, and so I may be wrong about this. But just with my anatomy and biomechanics understanding and using my logic, that's my approach for the lumbarization. So just continue as if you were never told that you had this problem. And if you have a feedback from me on that, I would love to hear it. So feel free to share in the a reply in the Student Hub and let me know if you agree or disagree with what I'm saying. So those are the questions from the Student Hub today. Take a quick look into the chat and see if I can catch up, and then we will sign off for the day. We're at just about an hour. So you enjoying the stream? I know we've been moving quick, but feel free to help support the channel. Hit that like button, share this stream or link with your friends. If you feel like this strategy can help somebody, especially the beginning. If you didn't see the beginning, the deep spiral of the body is a really cool thing to start applying to your life, and anybody can do it. So feel free to share that with your friends, and we do this every week. So don't forget to subscribe so you can get notified going every Wednesday at noon, just like this. So here we go. Vinny Jones, I've been diagnosed with lumbar radicular symptoms, DDD, bone spurs, facet. Okay, like the classic umbrella of all the things, right? PT, swimming, walking. You're able to run again. Honestly, you feel healed. That is great to hear, Vinny. I love it. I don't know if you're still here. What do you attribute to providing you with the most healing? I'm sure that people would be curious to know that. Is it all the things contributing, or is there one thing that you said, man, that really helped the most? I've been dealing with chronic back pain for 20 years. Then sciatica never started acting up, forced me to stop work, focus on healing my body, feeling great now. Aaron Carr, you're very welcome. Marcella, is a good sign my lower back pops when I do marching while doing 90-90 supine marching and physical therapy? No, Marcella, I don't really think that's a good sign. That's a sign of instability, and you want to stabilize that. This is something we talk about in the program. If you are in the program and you haven't seen this, you want to look into the FAQs. And I talk about the popping with marching, with the back anchor challenge, aka dying bug. And you kind of want to minimize the amount of popping. So no, it's not a good thing. Means things are adjusting. No, it doesn't. Yes, it does mean that, but it also means it's adjusting too much and it's unstable, most likely. Am I unstable? Yes, you most likely are. MRI showed spondy, which is a classic diagnosis for instability. Hopefully you're in the program, Marcella, because that is one of the things that I believe the program helps the most with, is a stenosis, spondy situation, which is my history. And the program has really been really effective for that. All right, Vinny. Yeah, good to hear. Yep, I will be there someday. Brenny. Okay, good to hear. Marcella. Oh, you are in the program. Module 2, going slow. Great. Going slow is my favorite thing to hear. Not because of any other reason, except it's the most effective thing you can do is go slow. I know in today's modern society, we want to consume content and move on to the next thing and then consume some more. But it's the worst strategy for core balance training. Core balance training, the slower you go, the better. It's like, getting some good, I'm trying to think of like barbecue, like Texas barbecue, low and slow. All right, RG, super informative. Thank you. And Shannon, since I lost weight, my nerve pain is worse in my L5 area. It's an interesting thing, Shannon, that you share. I don't know if I can open this can of worms today, but yeah, it's an interesting thing that often people who are overweight it almost seems like there's less incidence of back pain. And there are theories. I can come up with theories about that, but it doesn't really matter. It's healthier to be, in most cases, it's healthier to have a healthy weight, and you can improve the support of your spine through exercise and healthy movement. So those are the things that I would recommend. Thank you, Kevin. Thank you, Guillermo. Baby is doing well. Yeah, he's a very hungry boy, and we're learning that when he gets fussy, as he does, we just have to feed him more, and then he feels happy and sleeps, and we feel happy. So that's the way life's going for us right now. He likes to eat a lot, and he's gaining weight fast. Tyler, do you have testimonies, firsthand counts of students that have gone through the program on this stream rather than just reviews online? Just ask the people who are here, Tyler. Yeah, there's usually students here that are are former students, current students. If anybody's here live that has felt benefits from the program, please share in the chat. Let Tyler know. And so we have the testimonials on our website, Tyler, and we have about 10 times the amount of testimonials that are on our website that are just piled up in our inbox that I just haven't posted. We haven't gotten around to posting. So someday those will surface. And then there's also Trustpilot, which is kind of hopefully for people more of a unbiased platform where people can leave reviews and a little more trustworthy. So we're doing the best we can with that. And if you're in the program, you can always post in the student hub as well, Tyler, which is our community where you can interact with all the other students and ask any question you want, and the students interact there. It's pretty cool. Vinny, your work was a contributor to your back pain. Repetitive bending in the factory, and also took away your focus. You're welcome, Marcella. Guillermo, epidural lysis of adhesions. Epidural lysis of adhesions. Adhesions can be treated without, invasive stuff like injections or things, but if it's really bad adhesion, Guillermo, maybe they want to epidural you and then, it'd be too painful to do without an epidural. And so maybe that's why they want to do it. I don't really know anything about that, but epidurals are not too, typically, minus the tiny percentage chance of complication, they're typically not very, they don't really have too many long-term consequences. So if they need to give you an epidural and then take care of some adhesions that are in there, then that's what they think. Adhesions are real, and you can treat them with, massage or other things, stretching, mobilization. But it sounds like there might be some strong ones in there. So, all right, RG, my good friend, healed her back pain in 2 months. Marilyn, I get better every day. Sherry, Tyler, this is the best program I've ever tried. Oh, thank you, Sherry. After 10 years of back pain, this is the only thing that has worked. Love it. Aaron Carr, 1 weekend, just finishing the trial, and I feel relief in my low back already. Tyler, thank you. Former college athlete here with chronic pain for quite some time, hoping this program will help me feel good again. All right, Tyler. Yeah, I'm hopeful for you too as well. And, if you need any guidance, I'm here. I show up every week, minus the week that my son was born 2.5 weeks ago. So, but every other week I'm here and I'll answer questions for you. And thank you guys for being here. It's always a pleasure. Always makes me happy to see people showing up for themselves. And that's why I do this. So you lean in, I lean in back, and together we'll make a dent in the back pain epidemic. And just thank you guys. It's awesome. It's awesome being able to do this and feel like you're making a difference in the world. So until next week, if you haven't figured it out already, get down on the floor, connect to your core, and I believe you will feel benefits. And I will do the same. I practice what I preach, and we're going to try and be showing more of that through like Instagram and stuff like that. So if you don't follow us on Instagram, we're going to be starting to show more of what I'm doing in my personal life and through these videos as well. So, all right, guys, signing off. Thanks again. And thank you to all the students who just posted to just share for Tyler about their experience in the program. That really means a lot. So thank you. And I'll see you guys next week. Take care, everyone.